Good evening, and welcome to Common Health Insurance Problems in MS, Solutions, Resources, and Strategies. This webinar and telelearning series is brought to you by Can Do Multiple Sclerosis, the National Multiple Sclerosis Society, and the Multiple Sclerosis Society of Canada. My name is Laura Coyne, and I'm the Programs Manager for Can Do MS. Your moderator this evening is Sherry Perry. She is one of the managers of the MS Navigator Service delivery at the National Multiple Sclerosis Society. Can Do MS transforms lives. We deliver educational programs on exercise, nutrition, and symptom management to inspire and motivate long-lasting change for those with MS and their families to help them thrive. Please visit Can Do MS's website, mscando.org, to learn more about Can Do MS's online and nationwide in-person programs. Can Do MS is excited to partner with the National MS Society to bring you 15 webinars in 2017. At this point, I would like to turn the meeting over to Sherry Perry. Sherry?
Thank you, Laura. Good evening, everyone, and thank you for joining us. The mission of the National MS Society is to help people affected by MS live their best lives as they stop MS in its tracks, restore what has been lost, and end MS forever. We are pleased to have you join us in tonight's program, and you can explore other societies' programs, services, resources, and connection opportunities at nationalmssociety.org. The topic for tonight's webinar is Common Health Insurance Problems in MS, Solutions, Resources, and Strategies. No matter how people in the U.S. get their health insurance coverage from an employer, an insurance broker, through Healthcare.gov, Medicare, or another government program, at some point, most everyone faces a confusing situation or question they don't know how to tackle. In this one-hour webinar, advocates and counselors from the Patient Advocate Foundation and National MS Society will discuss common areas of confusion around health insurance affecting people with MS, how they work to resolve them, and resources and tips for getting the most out of health insurance coverage. Our speakers for this evening are Kimberly Calder and Emily Brown. Kim Calder joined the National MS Society in 2003 after holding a public policy and leadership positions at a variety of cancer patient and advocacy organizations. Since 2010, she has been part of the MS Society's Advocacy Department, where she is currently the Director of Health Policy. Kim has served on the governing boards of Empire Blue Cross and Blue Shield and the American Pain Society, and on advisory councils of the National Cancer Institute, U.S. Food and Drug Administration, and the National Association of Insurance Commissioners. She received her BA from Macalester College in St. Paul, Minnesota, and earned her master's degree in policy studies from the New School for Social Research in New York City. As a clinical case manager with Patient Advocate Foundation, Ms. Brown has special expertise in insurance appeals for off-label medications, out-of-network providers and facilities, and investigational and experimental procedures. She has extensive experience with Medicare, medical debt crisis, long-term care issues, and patient access to care. She brings a breadth of knowledge of federal, state, and local assistance programs and has a particular expertise in brokering resources for patients with cancer and chronic illnesses. Prior to her work at Patient Advocate Foundation, Ms. Brown worked as a social service coordinator at a skilled nursing facility and as a social worker in an adult day care setting. Ms. Brown has a bachelor's degree in social work from Christopher Newport University in Newport News, Virginia. I will now turn over the program to Emily.
Thanks, Sherry. Before we get into things, I just wanted to provide a brief overview of Patient Advocate Foundation services. We've been operating for over 20 years, and we have a team of case managers who've been assisting people one-on-one with issues regarding access to care, identifying insurance options, help with the disability process, appeals assistance, and much more. We also offer on-demand webinars through our Patient Empowerment series that discusses issues concerning patients with chronic conditions, and those can be accessed on our main website, patientadvocate.org/webinars. First, I want to discuss the importance of choosing the best plan for your needs. When shopping with health insurance, it's best to approach as you would any other big purchase. Some things to consider are, what is the best plan for you? Do you need a network of large providers? It's important also to check in-network providers, and that includes doctors, labs, facilities, hospitals, and pharmacies, some of those things that people don't always think about. There's deductibles. Sometimes there are two, so keep in mind that you could have a medical deductible as well as a pharmacy. You also have copays and coinsurance to keep in mind, as well as checking to see if your medications are on formulary. Think about how often you go to the doctor, which drugs you take, and what services you may need over the next year, and compare the cost of each plan. Many health insurers offer online tools to help you compare costs for health plans and treatments. Don't get scared off by high deductible plans. By the time you factor in all the other costs, including a portion of your premium and copays for other plans, a high deductible plan may actually be the least expensive overall. And we have a nice little graphic over here in the right corner. And it's interesting because the premium is actually supposed to represent the tip of the iceberg that you see, but all those hidden fees under the surface, like prescription drug copays and coinsurance, your deductible, doctor's visits, those are some of the things that people don't always take into account when they're looking or shopping for insurance. So things to think about when trying to save money on medical care. Talk to your doctor about other treatments and medication options, and you can feel free to be honest about cost concerns. If you communicate with your doctor, if you're unable to follow his or her recommendations when it comes to medication or care, they may be able to provide some resources or give you some tips that may help out. Ask your doctor if it's still necessary to take all other medications that you've previously been on. Shop around and see if there's other facilities, whether they're outpatient or standalone, that may be able to provide the same service at a cheaper rate. See if there's any advocates that may be able to help. It's important to be friendly with billing reps. They have the control, and they lots of times can put you in a payment plan, or nonprofit facilities have application processes where they can offer financial assistance, but you don't know unless you ask for it. Try to avoid collections whenever possible, as that can impact your credit. And negotiate, because providers may be willing to accept less just to get money coming in the door and to get the debt off their books. So when you're looking at transitioning to any kind of insurance, not just Medicare, it's important to make sure that you're getting your appointments out of the way and that you have enough medication to cover while you're switching from insurances, especially if this requires you switching medical providers. Be sure that your new insurance, that you provide your new insurance information to any new treating providers to ensure that bills are being sent to the correct insurance company. This avoids unnecessary denials and claims hassles. If you have prior authorizations in place, be sure you work with your providers to get them changed to the new insurance plan. Be proactive when transitioning and make sure to pay your insurance premiums on time. Specifically when you're transitioning to Medicare, these are just some things to keep in mind. Make sure that you're asking your current providers if they work with Medicare, or specifically if you're looking at Advantage plans, make sure that you think about that. Make sure you take into account your current prescription needs and make sure that your new Medicare coverage will also cover those prescriptions. This is just a quick list to refer back to when you're transitioning to Medicare or any other new insurance. At this point, we want to hear a little more from Kim Calder regarding accessing needed treatments.
Well, thank you very much, Emily, and hello, everyone. I'm going to review some ways that your health insurance plan may exclude or limit treatments even when it's technically covered by your plan. Unfortunately, this happens to people with MS and other expensive health conditions pretty often because insurers want to cut their costs whenever possible. Insurance companies can and will use every opportunity they've got to question the treatment that's been prescribed to someone and only approve payment for it once they're convinced that it's an appropriate treatment for that patient at that time. Prescription drugs are a very good example of these types of practices by insurers. Everyone's health plan covers prescription drugs these days, but you're probably aware that that does not necessarily mean that the health plan will pay for every single drug on the market, right? So just be aware that there's a big difference between a treatment that's covered in theory and one that's covered but also authorized or approved for payment. There's several different ways that health insurers can do this, and I'm going to highlight probably the most common ones. There's 4. Prior authorization, that's a term that you've already heard from Emily. Prior authorization is a requirement that a treatment, such as a drug or perhaps an MRI or even a procedure like surgery, gets authorized by the insurer before the insurer will pay for it. Most of the time, that's just a paperwork hassle between your doctor or nurse and the insurer, but sometimes insurers won't process all of it very fast, and you're stuck waiting for your treatment. If your insurer is interrupting your MS care, speak up. If the prior authorization process is delaying your treatment, you could potentially be putting yourself in a dangerous situation. And the result could be worsening of your disease or your level of disability. Likewise, so-called fail first requirements, which are also often sometimes called step therapy, is another insurer practice. This refers to when an insurer denies coverage of a prescribed treatment, usually a drug, but also some other type of treatment sometimes, because the insurer wants you to try a less expensive one that they think will work just as well. And now, to be fair, sometimes the less expensive option does work just as well. It's hard to know that in advance for people with MS and their treatment choices because of the nature of the disease. But more often than not, your MS doctor has selected a treatment because you both have reason to believe that that drug will work the best for you. And having to try a cheaper drug can be a waste of precious time that you could be on the drug of choice recommended by your doctor and improving. So I would have the same advice for dealing with these fail first requirements. If it's unreasonable for you to go on a cheaper alternative, speak up. Be your own best advocate. Tell your insurer your need for the treatment originally prescribed. Third, insurers can also list drugs that they cover on their formulary on different tiers, with the least expensive drugs on the lower or first level tier and the most expensive ones on the highest or specialty tier. Your portion of the drug's cost is based on which tier your drug is placed on. Insurers use tiers when there is more than one drug available for a condition, like the 14 drugs that are now available to treat MS. The problem is that insurers often think that all of these drugs are all alike and may presume that they're interchangeable, so they'll want you to go on the least expensive one. Try it, and if it doesn't work, then perhaps they will approve the more expensive one. They may cover the more expensive one your doctor prescribed, but put it on a higher tier that costs you more in coinsurance that you cannot afford. Again, if this happens to you, speak up. Use your rights to appeal or request an exception to your insurer's coverage policy to request that your drug be covered with a cost to you that is affordable. Now let's go to the next slide, please. Fourth is the whole issue of the health insurance plan formulary, or list of drugs the insurer will cover. Excluding certain drugs from the formulary is another way insurers avoid paying for high-cost treatments like certain MS drugs. Note that formulary listings can be very specific, including separate listings for different dosage, such as 10 milligrams versus 20 milligrams of a drug, or even quantities, such as 1 injection for every 28 days versus 1 injection for every 30 days. And those little details can really matter to your access to care. Also note that some drugs may be covered as a medical benefit rather than listed as a prescription drug if they are infused by a doctor or a nurse or in a clinic. So for example, Lemtrada, Tysabri, or Nivantrone may be covered as medical benefits rather than prescription drugs in your health plan. But what can you do if your drug is simply not on the formulary or at the right dose on the formulary? Again, advocate for yourself. Join forces with your doctor to write your insurer, making the case for why the plan should cover the treatment your doctor recommends. Emily will say more about this a little later on, and you can call the MS Society for some guidance. We can't write the letter for you, but we can offer you some advice. You know, if that writing a letter does not work, then you'll have to think about taking advantage of open enrollment the next time you have an opportunity to switch to a different plan. Now insurers must provide their formulary lists and details of their formularies to help people choose between plans before they even sign up. So having access to that information is a very important protection I want you to take best advantage of. And with that, I'll turn it back to Emily.
Thanks, Kim. Wanted to briefly touch on home health services. Up until this point, home health services have been only extended to people who are expected to improve with skilled services, but a pretty recent statute affecting home health recipients is called the Gemmo versus Sibelius Settlement Agreement, which provides maintenance coverage standards for skilled nursing facility, home health, and outpatient therapy benefits. And it's applicable when a patient has no restorative or improvement potential. It allows patients to qualify for home health care just to maintain their condition or to slow deterioration of their clinical condition. And the important takeaway here is sort of a shift, is that services are now extended to people regardless of whether or not they'll improve. So it's important that we remember that the services are medically necessary. It doesn't matter whether or not there will be actually any improvement from the skilled service. Next slide. So when you're looking at home health, things to think about to maximize those benefits. Your doctor needs to be kept updated on your status. Have your physician continue to certify the need for services and adjust the plan if more is needed. Recertification is actually a requirement of home health. You're experiencing any declines or any changes in your functioning. If you are experiencing those, they may be able to actually increase or continue services for you further what was initially authorized. It's important to become familiar with Medicare or private long-term care policy guidelines if you have one. Sometimes there are additional benefits that are offered through these policies that are over and above what Medicare offers. Also, it's important to speak with a social worker or any advocate regarding your eligibility for other benefits like Medicaid, Medicaid special needs programs, or any Medigap policies. They may also be able to extend additional benefits for home health for you. And become familiar with coordination and benefits to help understand who pays first if you have multiple insurance policies. Also, something to consider, if you or a senior loved one is a veteran, veterans who serve more than 90 days of active duty with at least 1 day during a wartime period with an honorable discharge may be eligible for veterans pension. And veterans who need long-term help with activities of daily living like bathing, dressing, or toileting, or even veterans whose spouses need that help, may actually be entitled to monthly disability payments known as aid and attendance by the Veterans Association. And only a little over 5% of veterans who are eligible for these benefits actually receive them, simply because so few veterans know about the benefits or how to qualify for them. And if you're interested in receiving these or learning more, help's available from Veteran Services Organizations. So discussing outpatient therapy versus home health for Medicare beneficiaries, it actually, interestingly enough, can also be provided at the same time as home therapy, and it's covered after the Part B deductibles met, covered at 20%, or excuse me, you're responsible for 20% after the deductibles met. Also, durable medical equipment is covered, like wheelchairs, walkers, or oxygen, or other durable medical equipment. There is a cap on the Medicare, what they'll provide for outpatient therapy. However, $1,980 for physical therapy and speech-language pathology combined, and $1,980 for occupational therapy on its own. And you may actually qualify for an exception to the therapy cap limits, and this is something that your therapist or therapy provider would have more information about. They would need to provide documentation to show that the services you're receiving are medically reasonable and necessary. And they would need to show that in your medical record as well as in the Medicare claim form. And you are actually eligible for a lot more therapy if requested and if medically necessary. The threshold for additional benefits is $3,700 for physical and speech language, and then an additional $3,700 for occupational therapy. So shifting gears a bit, we want to discuss insurance denials and what to do if you get one. Insurance plans are contracts based on your plan language. A denial happens when your insurance company makes a decision that a claim or request for services, called a prior authorization, is not covered. And appeals are contract disputes initiated by patients or providers when they disagree with a decision to limit care made by the plan. And an appeal is a formal request for a fair and complete re-review of the decision made by the insurance company. Rules for appeals are outlined in your plan language and also may be listed on your denial letter or an explanation of benefits. When you receive notice that something's been denied, review the codes on the explanation of benefits or denial letters for specifics and instructions. This is like a roadmap for moving forward. And when you get the letter, it's multiple pages, sometimes 10, 12, 15 pages. And a lot of people focus on just the first page that says the reason for the denial. But actually, all those ancillary pages in the back that sometimes people toss in the trash or the shred bin, that's where the important information is. It gives a lot of information about where the appeal needs to be sent to, information about the timelines for appealing, addresses for requesting more information about their denial decision. So that's all important information, so don't chuck that in the trash right when you open the envelope. Another important thing to think about is to call your plan's customer service line to clarify. A lot of times things can be cleared up right on the phone with a customer service rep because sometimes it's just a clerical error. Same thing, if the denial is a result of improper coding or missing documentation, you may be able to clear that up a lot quicker by coordinating with the billing at your facility, and then you won't have to move forward with the appeals process at all. Make sure you're taking notes on all of your phone conversations with your insurance company. Keep a little notebook and jot down the date and the time of the phone call, who you spoke with, what you talked about, just so you have that for your records. And this really can be to your benefit because appeals have been won and claims have been paid based on reviewing calls with customer service representatives. I know a lot of times out-of-network care as well can be an issue for people with MS trying to get specialists out-of-network. And lots of times approvals for care out-of-network can be awarded if you can prove that adequate care is not available in your network. As well, sometimes it may seem like insurance isn't covering anything towards your care if you haven't met your deductible yet, or if you have a large coinsurance component that results in a big charge for a specific treatment or service. However, the important thing to remember there is that's not actually a true denial, and therefore you can't appeal your deductible. Something to consider when appealing is make sure you understand the process and the timeline. I've seen timelines anywhere from 15 days up to 180 days. So really, it's important to remember that timeline so you're not missing any opportunity for timely filing. Keep your doctor's office updated on the status of the appeal so you don't go into collections. You don't have to necessarily pay the bill before the appeals process is all wrapped up because there may be a delay in getting your money back. but the billing office may actually be able to put your account on hold while the appeal process is moving forward, and that way they're not begging you for money. So there's two types of denials, actually pre and post service. So if it's still before the treatment was received and the prior authorization is still necessary, check with your doctor to see if there's any alternatives that you could be doing in the meantime while the preferred treatment is going through the appeals process. And actually, if your physician determines that a delay in treatment will seriously jeopardize your health or life or affect your ability to regain maximum function or subject you to severe pain, you may be eligible for an expedited appeal. Typically, that's a 72-hour decision once the appeal has been filed versus standard of 30 to 60 days. And as well, state consumer insurance agencies like State Board of Insurance, often they can clarify your rights and provide additional guidance on appeals. As well, something to talk to your doctor about is a peer-to-peer conversation. You may not even have to move on to the appeals process if your doctor is willing to call your insurance company and talk often with the medical director of the insurance company. They can have, again, it's called a peer-to-peer conversation. They can have this discussion. Your doctor can lay out his or her reasoning for prescribing a particular treatment or medication for you, and that may be all that needs to happen in order for that treatment or medication to be covered. Your doctor gets an opportunity to speak directly to the medical director at the insurance company, and oftentimes that's enough to allow coverage for that treatment or medication. So moving on to writing the letter. This does seem overwhelming, but if you stay organized and stay on top of things, you can really become successful. The most important element of your appeal packet is a clear and concise letter. It's important to detail your argument that directly addresses the reason for the denial. Some examples of denial reasons is that your insurance company may provide are the service is not medically necessary, it's not a covered benefit under your plan, you're receiving care from an out-of-network provider, or potentially it's an experimental or investigational treatment. The letter can be written by you, a doctor, or an advocate on your behalf. Try to remain factual and not emotional when you're writing your letter. For your insurance company, this is a business decision. It's not personal to you. They're trying to cost save. So it's not a direct attack on you. They're just trying to maintain their own policies and, again, save themselves money. So it's important to submit your appeal on time and with the required components. Ask your physician to write a letter of medical necessity that discusses your personal medical history and offers a rationale for ordering the denied treatment or medication. Your physician's office may be able to provide or suggest medical journals or peer-reviewed articles to support your appeal. With your letter and the letter of medical necessity and any medical journals you can provide, make sure you also include a copy of the denial letter from your health plan, copies of any correspondence between you and your health plan or between you and your healthcare provider and your health plan. So after you send the letter, it's important to track the submission. If you're sending by mail, send it certified and with a return receipt so you have confirmation that it was received by the insurance company. Again, because of the timely filing and because they have deadlines for when you have to submit your appeal, it's important that you have that confirmation because there's many times that even myself have submitted an appeal. I've gotten confirmation that it's been received, and then the insurance company says they never received it and they have no idea where it is. If you have the tracking information, it's easier to either resubmit, or they may be willing to waive if you're over the deadline. They may be able to waive that and still accept your appeal even if you're past the deadline, if you have confirmation that you sent it. And as well, if you're sending it by fax, make sure you keep a copy of the transmission report and plan to call in 48 hours just to check and ensure it's been received. So lastly, you should receive an official notice within 7 to 10 days that your appeal has been received, and you'll receive this from your plan. If you don't get this, contact your insurance company to verify the appeal has been received. As well, if you're faxing, make sure that the correct number of pages has been received. In my experience, if you file an appeal and you send 60 pages and then you call to check the status, sometimes they're telling you, oh, we only got 10 pages, only got 15, because maybe there was an issue in the transmission of the fax. So make sure they have your whole and complete appeal so that nothing gets left off. So the timeline for a decision depends on what type of appeal it is, what level of appeal you're at, and then several other factors. But typically, again, if it's an urgent or expedited appeal, you'll receive notice within 72 hours of appeal of the decision, and then up to 60 days if it's post-service. And typically, if it's expedited, they will call you and provide the decision to you over the phone, but they will always follow up with a written response. So now we're going to shift gears a little bit and hear some information from Kim regarding changes to our healthcare arena.
Thanks again, Emily. With all the attention to healthcare reform that's in the news these days, I just wanted to bring it up just to say a few words about it, because I honestly think it's adding to all of the constant confusion about health insurance. And frankly, it's just scaring people unnecessarily. So in the hope of calming some fears, I'm just going to comment a little bit about healthcare reform these days. I think the term healthcare reform means a lot of different things to a lot of different people, and I think it's completely overused. Most people think that it would be easy for anyone to think that any change in their health care or their coverage is tied to something related back to the Affordable Care Act or some other health care reform. Well, in fact, it probably isn't, but we're not going to go through the whole laundry list of changes related to the Affordable Care Act tonight. But do remember, because medicine and health care are evolving all the time, the way that health care is delivered is constantly evolving too. So I think of health care reform as something like just a constant dynamic process. The Affordable Care Act, however, was one very specific law known as the ACA, or Obamacare, and that had a very big impact on two groups of people particularly and exclusively. And frankly, I doubt that there's too many of them that are on this call tonight. They are people that were completely uninsured prior to the Affordable Care Act. And secondly, people who needed to buy their own health insurance because they weren't eligible for employer coverage or Medicare, Medicaid, or anything else. That's only about 7% of the entire population of the country. That's why I say I doubt there's really very many of them on this call tonight. Now, when we started planning this webinar months ago, honestly, I was very fearful that Congress was poised to roll back many of the coverage provisions and advances that we made through the Affordable Care Act. But to date, they have not done so. Now, Congress and your state governments are likely to enact some additional health care reforms, and hopefully those changes are going to help bring costs down, because that is at the top of the National MS Society's agenda and many, many others. But it's now very unlikely that major changes will be enacted through Congress that will take coverage away. And we are very, very relieved that I'm able to say that at this point in the middle of September. Most people will not be affected by additional changes made by Congress, I don't think. But remember that your insurance company also can always make some small changes on their own. And I call those healthcare reforms also. Now, can we go on to the next slide? That leads me into some comments about open enrollment. Open enrollment season is coming. It's nearly upon us. And this is my plea that you take best advantage of your open enrollment opportunities, no matter what type of insurance you have, to make sure that you're getting the best coverage for your needs and at the lowest possible cost to you. Open enrollment dates vary based on the type of insurance you have. The fall is typically open enrollment season for most people, but not always. For example, some employers tie their open enrollment season or weeks specifically to their business's fiscal year. And Medicaid is always the exception here because you can always enroll in Medicaid at any time of year as soon as your application for Medicaid has been approved. Half of you are probably enrolled in Medicare, and the open enrollment period for Medicare coverage for 2018 is coming very soon. It begins on October 15th and ends on December 7th. And again, that is for Medicare coverage beginning on January 1st. MS Society navigators can help answer your questions about Medicare choices, including drug plans. Now, I also have some new information for those people who buy their own insurance through the Affordable Care Act marketplaces, if there's any on the phone. Your open enrollment period is much shorter this year. It is only 6 weeks long instead of 12 weeks long as it has been for the previous 5 years. Open enrollment for the Affordable Care Act marketplace plans starts on November 1st and ends just 6 weeks later on December 15th. And those would be for plans that take effect on January 1st of 2018. Unfortunately, the amount of one-to-one help that the Affordable Care Act marketplaces made available to help people shop for coverage has been scaled back dramatically. Now, insurance brokers can also sell individual insurance policies, but, and this is an important but, people whose income makes them eligible for a tax credit that makes those premiums much more affordable cannot get that tax credit unless they enroll through the Affordable Care Act marketplaces and not through a private insurance broker. So my best advice to these folks that buy coverage through the Affordable Care Act marketplaces is start early. The Society would be happy to help refer you to help in your communities if we know about it, but we cannot make promises. If I were enrolling myself in one of these policies, I would start the process as soon after November 1st as possible, and I would keep at it until I was satisfied that I was choosing the right plan for me. And best of luck to you in this process. And with that, I'm going to turn it back to Sherry.
Thank you, Kim and Emily. Okay, so I think we're ready for some questions. Again, a reminder, if you have a question, type it into the question chat box found on your control panel. We have definitely had some questions submitted, and I'm going to start with one that we've had a couple of questions in this same form. And Emily, I'm going to send this first one to you to start off with. What can I do if I don't have any insurance? My income is such that I cannot get any government aid, and my income is such that I cannot afford to purchase insurance. So can you talk a little bit about options available for people who cannot get insurance coverage?
Absolutely. So I know it may feel pretty overwhelming not to have any insurance coverage, but you actually do have some options. So anytime you're in an emergency situation and you're in an incredible amount of pain or you have an injury, always go to the emergency room. Emergency departments cannot turn you away due to not having insurance. So always make sure you head there first and worry about the billing later. Nonprofit facilities have to offer financial assistance to patients who don't have the ability to pay their medical bills. So the financial assistance I was mentioning before, you can apply for financial assistance through those facilities. Typically it's an application process. They'll ask you for your income and they'll ask you for proof of income, but if you don't have any, the facility will write off your charges. If you don't have funding to pay for it, you can't do it. So they will have to eat those and write off those charges. Another thing, if you're looking for ongoing care, not just in an emergency situation, look to any sliding scale clinics in your area. And there's a couple of websites you can go. There's HRSA, I believe. They have a listing of sliding scale clinics in your area, as well as needymeds.org, N-E-E-D-Y, meds.org. They have a listing of low cost, no cost, or sliding scale clinics, and you can actually put in your area where you are, and then you can check to see what clinics are available in your area. And that's a good place if you're looking to be set up with a specialist. Start with a primary care provider first, and then they can refer you out to another specialist who is able to, provide you ongoing specialist care.
Great, thank you. I have going to ask Kim this next question. Kim, how often can insurers revise their formulary list in each calendar or benefit year?
That's such an interesting question, Sherry. Thank you for that and for the person that typed it in. It depends on the type of plan, but generally there has been a movement to assure that any plans that make any changes to their formulary or any of their other benefits must provide advance notice to beneficiaries well in advance, so there is ample time to make changes in care. Some of these are advances in state law, so they would affect some plans and not others. But generally speaking, well, in Medicare, the Medicare direct plans can only make those kinds of changes once a year, and they must notify beneficiaries in advance of the open enrollment season. They must tell you any changes to the benefits and changes to costs in advance of the open enrollment season. They send you a letter that's called the Annual Notice of Change, and that is often copied. That same type of approach is copied by some other private health insurance plans for non-Medicare beneficiaries, but their practices are probably not as standardized as Medicare.
Great, thank you. Another theme of some of the questions that are coming up have to do with the cost of medications. So perhaps you can both address this, maybe Kim addressing private insurance and Emily addressing Medicare cost for prescription drugs, or help with costs for prescription drugs, excuse me.
Well, I can just mention some things that we often get asked about and often make referrals for people with MS who call us about the very, very high cost of their out-of-pocket costs, their coinsurance, and their copays. Every single one of the manufacturers of the 14 MS drugs does provide a patient assistance program whose eligibility is determined by them. The MS Society has absolutely nothing to do with it. But these programs do tend to be fairly generous. You must be income eligible, but there are programs for people who are working age people, so even if you're well insured, but your out-of-pocket cost, your copay or your coinsurance is really unaffordable for you, then these programs may be an option for you if you are income eligible. We do not know exactly what the income eligibility criteria for them is. That's proprietary information, but we can refer you to those programs.
And as far as Medicare recipients, sometimes the manufacturers do have programs that you may be able to look into. Sometimes Medicare patients are excluded from those, or government-sponsored insurance like TRICARE or Medicaid. But in some cases, if you can show that you've spent a portion of your income on medications throughout the year, they may be able to make an exception for you. There are, as Kim was mentioning, copay assistance organizations. There aren't any available at this point. I did check on that prior to this presentation. There aren't any open copay organizations or copay assistance organizations offering assistance at this time. But I do recommend going and checking frequently, maybe even weekly. There are some Patient Access Network Foundation has had funds in the past. The Good Days Foundation has had funding recently. And actually, our Patient Advocate Foundation Copay Relief Program has also recently had funding. like I said, there is no open funding currently, but since there is such a high need and high demand for those funds, the funding does come in and out pretty frequently. So be on the lookout for that and check in every now and then to see if there's any available funding.
Mm-hmm.
Thank you. And you can find a list of the nonprofit copay assistance programs as well as the manufacturer programs on the National MS Society website. And that's nationalmssociety.org/financial assistance. Thank you. This next question I'm going to leave up to both of you. Is it worth the trouble to appeal an insurance decision that a device to assist walking is not medically necessary?
I'm going to ask Emily to take her first stab at that one. She's really much more experienced in these appeals than I am.
It is always worth it to appeal, in my opinion. You'll never change anyone's opinion. You'll never change the decision if you don't try. So it's always in your best interest to move forward with an appeal. Your insurance company expects that you will give up. And a lot of times patients do give up, and people kind of, say, oh, my insurance company didn't cover this. Oh, well, I just will move on to something else. But it is always, always in your best interest to appeal. 40% actually of all first-level appeals are overturned. So that's a pretty strong statistic. So absolutely, talk to your doctor about it. See if he or she is willing to write a letter of medical necessity for you, as I was discussing before. That's really, or even, as I mentioned, the peer-to-peer conversation. If your doctor can give a call to your insurance plan, discuss the need for you to have that device, and that may be all that's needed. If you really feel that you do need that, it's worth your time and effort to go ahead and try to appeal. Absolutely.
I'm so glad that Emily answered that way, because that's what I was hoping she was going to say. I'll also just say for devices like that, another angle you may try is see if the manufacturer might give you access to one on a trial basis, so you can determine whether or not it's really very effective. And if it is very effective, and you can document how it is effective, sort of the before, during, and the after, that documentation, that's your proof right there. And think what you could show to an insurer. I mean, now, we can all take little movies with our iPhones. You can take little videos or lots of pictures. So be creative, I'd say, and put forward the strongest appeal you possibly can.
Absolutely. And to piggyback on that, I mean, it's hard to know what documentation was submitted with the authorization. So there's a chance that, with information like Kim just, brought up, that would be really compelling to your insurance company. And as well, at the end of the day, there are resources if you feel that you do need an adaptive device to help you walk. There are other resources to obtain one if at the end of the day insurance is not wanting to cover that for you. You can always check out like Salvation Army or those types of charity shops, as well as sometimes local fire departments also carry adaptive equipment that you may be able to rent or loan from them.
Great, thank you. Next question comes regarding Medicare annual cap for physical therapy. What if a person requires more physical therapy than the Medicare annual cap, including the $3,840 for extension? Emily, do you want to take a start at that one?
Yeah, so it is difficult to get additional therapy over and above what even the additions are. I'm not familiar with anyone that has been able to get additional limits over the additional limits. That makes sense. but there's always an opportunity to talk with your providers about that. The money does go quickly. The $1,900 that they initially allot, that can be a few months. That can be eaten up in a few months. So it is good to stay in contact with your providers. They may know more, to be honest. Like I said, I don't know of anyone that's ever been able to get an extension over and above that additional $3,700, but your therapy provider may have more information on that. Sorry.
I'd just like to add on to that, because that's absolutely correct. This has been a major issue in MS care for years now. The MS Society has been working to overturn those caps by changing Medicare law for years now, in fact. It's been a great frustration to us. But we are encouraged at least that there is good information out there for consumers to try to help them, at least pull together the documentation that might make the most compelling argument to try to persuade Medicare to grant an exception. There is an organization called the Center for Medicare Advocacy that has a robust website, and included on that website are some tips. I can't remember exactly what the document is called, but it's basically advice for trying to appeal to Medicare for additional therapy services past those caps.
Thank you. We have another question similar to the last question regarding physical therapy. I have a high deductible. What are my negotiating strategies with physical therapy company when I receive the anticipated high bill?
Okay, I can address this. This is Emily. You know, it's when you get those bills and they're overwhelming, it's easy to clam up and not know what to say when you're thinking about negotiating. But when I call with patients or with you know, people who have chronic illnesses, you just have to be honest with the billing representative. Call the number that's listed on the bill, ask for a billing representative, and you can let them know what your financial status is. Say, I'm on a fixed income, I make $900 a month, this bill is way more than I'm able to handle at this point. And they may be willing to put you on a payment plan or reduce the bill, or even, like I mentioned, the facility may offer financial assistance that you can apply for. Something else to think about too, if you get on a payment plan with them and you're consistent and you're making good faith payments month after month, they may be willing to write off your balance towards the end of the bill. If you've been consistent and then maybe you hit a rough spot, or your car needs work, or you have some, you know, unexpected expenses, you may be able to approach the billing facility and say, hey, you know, I've paid X amount of dollars every month consistently. Can you please just write off the remainder of this balance? And in some circumstances, they really may be willing to do that. But I just recommend that you be honest with them about your income, about your situation, maybe about other bills that you have, how you're trying to make sure that they receive payment. You're not trying to shirk your responsibility. You're not trying to not pay. You just need a little bit of help, and you need some time to make sure that they get their money.
Thank you. Kim, I'm going to start with you with this question. Can you talk a little bit about trying to access off-label medications and what assistance, if any, is available?
Sure. I'll do the best I can with that. And first, I'm just going to explain a little bit about the term and how insurers tend to think about off-label medications or anything else. As many of you are probably aware, when the FDA approves a drug for the market, literally a label, the wording of the label is approved, and that's a legal process. Off-label means your doctor has prescribed something whose purpose is to treat something that is a little bit different than what that label of that drug describes. This is extremely common, especially in cancer care. In fact, most of the anti-cancer drugs that are prescribed in this country today are prescribed off-label. Insurers have, everybody's health insurance policy has a clause that says excluded are investigational or experimental therapies. That actually is, it's a protection. It is a consumer protection. We might think of it as annoying or problematic that it's not, they're not covering emerging new therapies, but in fact it is a protection against anything like really just bad care that has absolutely no evidence base for it at all. But unfortunately, insurers will often use that very broad and strong clause to argue that they are not contractually obligated to pay for off-label medications because they are not exactly what is intended for that treatment. It's been a problem for many, many years. There have been changes to Medicare law to assure that Medicare therapies, or at least are being paid for at least anti-cancer drugs that are prescribed off-label. Many private insurers will use this as a reason to deny coverage for off-label drugs as well. Sometimes they will pay for off-label drugs that are less expensive. Sometimes the only ones that they really bother to deny are ones that are pretty expensive drugs. Again, if you are denied, the best thing you can do is work with your doctor and try to come up with the strongest argument for why a certain therapy is necessary for you at this time. And if you have tried it once and it was something that was effective, take full advantage of that. Really document how effective something was. And I'd even recommend that if your insurer will not pay for an off-label medication, but you are fairly confident either from your own past experience or just your doctor's recommendation that an off-label drug may be helpful to you, I'd even suggest you consider paying for it out of pocket once, so at least you have the opportunity to try it and see if it really is effective, if it's beneficial. Then you have clear documentation that you could then present to your insurer, and hopefully that would work. I think that's about the best I can do on that difficult question.
Yeah,
that comes up
I'll hop in on that a little bit as well. Something to, I know Kim mentioned paying for it. Sometimes manufacturers will offer compassionate use for a medication, especially with the denial. They have patient assistance programs, and the manufacturer itself may be willing to provide the medication to you at no cost if you meet their program guidelines. If there has been a denial, oftentimes you do have to provide the manufacturer the denial letter, and sometimes they even want you to have appealed first before contacting them or before they can approve you for the program. But again, as Kim mentioned, appealing is incredibly important. Make sure you're looking for articles to support the use of the medication. There are clinical trials going on all the time that are written up in peer-reviewed journals and medical journals all the time. So I would suggest even going on Google and looking up, X medication to treat X diagnosis and see what comes up. And Google even has a special section for peer-reviewed journals and articles. Sometimes you have to be subscribed to view some of them, but you will get the gist of the article just through the abstract, and that may be enough to provide with your appeal those additional articles to support the use of the medication for your diagnosis.
And thanks for that, Emily. And I think this is my good chance just to do a plug for one of the resources that we have at the National MS Societies. We have developed some template appeal letters for commonly prescribed MS treatments, for example, that do cite studies from the literature. And these are kind of ready for your doctor to customize to you or the patient, and send that letter in as an effective appeal. For example, we do have a template letter if you get denied Provigil or Nuvigil, which is a treatment that helps many people with MS with their fatigue. unfortunately is not labeled for MS fatigue. It is labeled for things like all kinds of sleeping disorders or nighttime shift workers.
Yeah, as well, Patient Advocate Foundation, to couple with those sample appeal letters, we also have a publication to guide you through navigating the appeals process that's available on our website, patientadvocate.org.
That's excellent.
I have definitely seen both of those resources, and they are definitely great resources. Thank you. The next question is regarding the Affordable Care Act. And I'll let you two decide who takes it, but the question is, how do I determine if my income makes me eligible for ACA?
I'd be happy to take that. Well, everyone is, I think what you're asking is, how do you find out whether or not your income makes you eligible to get the tax credit to help make the premiums for ACA plans more affordable? You can look on the website called Healthcare.gov. There is a place in there where you'll be able to get a quick read. You'll be able to put in your income somewhere and get at least a preliminary response. Also know that Healthcare.gov also does have an 800 number that is staffed at 24/7, and you will be able to get some initial read on that through Healthcare.gov.
Thanks. Emily, do you have anything to add to that?
No, I think Kim wrapped it up good there.
Wonderful. Okay, this next question is regarding, we have a couple questions regarding that people will be transitioning to Medicare, or once they stop working, they'll be going on to Medicare, and they want to know what should they look for in a supplemental policy in regards to MS.
I'll take a crack at that. That is, well, first, I'm really glad somebody's asking the question. That is, that's a major transition in life, and I want to make sure that people really take that very seriously and ask a lot of questions and get support wherever necessary, just to make sure that you're getting the best combination of coverages or whatever coverage you're going to need at the least expense to you as you go through that transition. Otherwise, I would say the answer to your question is pretty much what we would say for anyone. You know, the types of things that you want to make sure that you have access to as a person with MS is very robust, comprehensive coverage. Certainly, you're going to need prescription drug coverage. You may need to buy that as a standalone prescription drug policy for Medicare beneficiaries, or you may be able to access that through a Medicare Advantage plan that also includes prescription drugs. I don't know your situation, so I don't know if you're going to combine Medicare with perhaps a retiree plan that's also from a former employer, or Veterans Administration coverage, or even Medicaid. But again, you can get help trying to figure out the combination of things that you'll be covered for. Make sure that you don't buy more insurance than you need. But also, you want to make sure that you have access, of course, to a medical specialist. You want to check the, if it's a network policy, you want to make sure that you're going to have access to the doctors and or hospitals and or other therapists and pharmacies that are important to you. Remember that the typical monitoring devices that are needed, tests that are needed to monitor MS include MRIs, periodic access to at least a neurologist. You may need mental health specialists at some points. You want to make sure that those people are also in your network. You may need durable equipment at some point. These things are all included in what's called the essential health benefits. That was an attempt to define at least a minimum set of benefits for the Affordable Care Act policies. And those were determined to mirror pretty typical comprehensive employer-based policies before the Affordable Care Act. We're hoping that that really does set a standard for the country. But that's the type of robust, comprehensive coverage that I would recommend anybody with MS needs, no matter who they're insured by.
And I'll just pop in. If you're looking into like a Medigap plan, a Medicare supplement policy, make sure that you're looking at the time frame for enrolling. You must do that within 6 months of being enrolled in Medicare Part B, or you waive your right to be guaranteed issue, which means that Medigap insurance providers actually have the opportunity to underwrite you or increase your premium rates for pre-existing conditions. And make sure you're, if depends on how you're eligible for Medicare, because not all states extend Medigap policies or make them eligible for patients to purchase if you're under 65. So if you're receiving Medicare in relation to disability, you may not be able to purchase a Medigap policy until you turn 65, because not all states allow you to purchase those plans unless you are 65 years old.
Or at least within the first 6 months that you're in Medicare.
Exactly. Right.
Thank you. It looks like we have time for one more question, and I'm going to let Emily start with this one. My drug manufacturer covers my out-of-pocket cost via their program. Do they follow the same standards as insurance companies where they must give notice when the assistance program goes away?
Oh, that's a wonderful question, and it is absolutely up to the manufacturer. The Office of the Inspector General does sort of mandate those programs. However, it's up to them as to when they extend those programs to patients and when they don't. So they should and most likely would give you advance notice if there were any changes or if the program was dissolving, but there, to my knowledge, is not an overarching guideline for how to provide that notice to patients.
Great. Thank you. Very, very informative. I really appreciate this presentation, Emily and Kim. I'm going to hand it over to Laura.
Terrific. Thank you so much, Sherry, for moderating the call, and Emily and Kim for some great information. As we conclude the webinar, I would like to encourage you to utilize some resources that are available on the Can Do MS website. All of our webinars are archived on our website. We also have our e-news, as well as the ability to submit questions through our Ask the Can Do team. You can also find a list of library articles, or you can find library articles with comprehensive MS topics. And again, that's all available on our website, mscando.org. And I believe Sherry's going to discuss some of the resources available at the National MS Society website.
I will. Thank you so much, Laura. I just also wanted to highlight some of the National MS Society resources dealing with insurance. As Kim mentioned, we do have an appeal letter toolkit with sample letters that you can share with the providers where they can really tailor it to your specific needs by just putting your specific information in those templates. We have a wealth of health insurance specific information on our website, including our access to high quality healthcare principles, which guides our work. And we also have a team of MS navigators that can provide information, resources, and guidance so that you're able to make the best decision based on your specific needs. If we did not get to your question this evening, feel free to email your health insurance related questions to healthinsurance@nmss.org. You can also call 1-800-344-4867 and ask for an MS navigator, or visit our website at nationalmssociety.org/healthinsurance. On that web address, nationalmssociety.org/healthinsurance, you can also find a recording of last year's webinar, Health Insurance, What Everyone Needs to Know. Last year's webinar provided a basic overview of the different ways people with MS and their families can get and keep health insurance, how to plan for transitions, such as moving from employer-based coverage to Medicare, and what to expect as an enrollee in private or public health insurance plan.
Thanks, Sherry. And something that I'd like to share with you is September is Can Do Month. And we are celebrating Can Do Month by trying to figure out how we can kick MS. Our tagline is #KickMS. What we are asking you to do is go to our website at mscando.org /CanDoMonth and share a photo or a video and show us how you kick MS. So we'd like you to join the movement and help us kick MS this month. In addition, I'd like to encourage you to continue participating in our webinars. The next webinar in our series is Discover the Invisible, Pain and Depression in MS. It will be on October 10th. Again, it will be at the same time, 8 o'clock Eastern Time, and you can register free of charge on our website. I'd like to thank you very much for participating.